Hello, my name is Wei Tao Cheong. I'm here to administer medication through Piggyback for you today. Is that alright with you? Can you please tell me your name and your date of birth? Thank you. Let me check your bracelet to verify. I'm here to do that today. The reason why I'm doing that today is because you need it for your post-op as an antibacterial medication to prevent you from sepsis. So I'll bring the supplies after to start the IV start review. During the process, please let me know there's any symptoms or adverse effects while I infuse the medication, and do you have any pain in the IV sites? Do you have any pain? Let me check your IV site. Have hand hygiene, make sure it's clean. Is there any infection as well as any redness? Okay, it seems fine to me. It's pain tint. I'm allowed. It's that painting, then there's nothing wrong with your eyesight. I can continue the intervention, and also let me check your IV. Oh, it's painting, and the rate's going right. Okay. Oh, got supplies. Come back. Hand hygiene. Okay, so medication tomorrow. It's perfectly fine. It matches. No allergies to this medication. The reason why he's taking it is because to prevent sepsis or past history she has surgery. Oh, he has surgery. Okay. Client understands. Do you understand the treatment? Okay, and he said yes. Intervention? Yes. Then I'll start getting the medication. So I need 2 milliliters of the drug. Get 2 milliliters, a bit more. Before I start, I'll clean for 15 seconds before I insert the needle, so it should be clean and dry. Then insert the needle, get 2 milliliters, withdraw, pull, strong, and make sure there's no air bubbles. Good. A little bit more. Okay. And then pour the remaining ones out. Do the same. Make sure no air bubbles. And that's 2. Clean for 50 seconds and then make your vial again. And insert the medication. Good. And you want to get the needle safely inside and lock. Perfect. But obviously, when I enter the medication, I would have cleaned the port first before entering the medication to make sure it's clean. Obviously, then so it would be done before I enter the medication. So make sure it's always sterile, and then you make sure mix the bag. Obviously, before you enter the medication, you want to check this patent and there's nothing wrong. It's clear and it's not expired before you even put the medication. But assume this is a good bag and you already checked beforehand. And you mix slowly. And then you would label the drug, the patient's name, the drug itself, the amount, and the date and time, and you make sure you can initial it. And then you check the MAR again to verify the drug and everything is right. The rate is correct, the medication is correct, the right patient as well. And okay, it's good. Now you can continue. You put the IV back here, and then and obviously the packaging here is I already opened it for practice, but it's closed. Pretend it's closed. The right drop factor, and make sure there's not expired. There's no kinks and looks good. Okay, you take this out to hang your bag. Okay, lower. And before you prime your tubing, you want to close all the clamps. The rate's already missing properly, but you want to start doing the medication. So of course you want to close the clamps before you administer. Obviously you want to clean the port for this port as well before you enter the medication. Let's start. Open the port. It's painted. Do such a technique. You don't touch both ends. You don't have to touch ends. it's capped. Then you open the part and make sure this cap is closed to prevent spilling. And then you insert. Insert quickly. It's already open already. Okay, insert the port. Okay. As you can see, I put this the other way around my bag. Should be this way, looking this way. Fill it to you prime it to 1/2. And you prime it, open slowly. And stripping, it's primed, so no waste medication. And you want to make sure this is clean. To aseptic technique, open this up. Okay, it's clean. You swab this for 15 seconds, the other part. Make sure the clamp is closed, everything's closed, and then you insert it. Okay. Insert it. Aseptically. Perfect, that's locked. Good, now let's paint and make sure this is locked. Rate, calculate the rate for a full minute. You want to calculate drop rate. It's 2 milliliters, it'll be 17 drops per minute. For 50 seconds, it'll be 4 drops, and then you return. You calculate for 4 drops per minute while opening. You close this you fully open this clamp, then you open the main clamp, and then you calculate 4 drops per minute. And then, yep, administering 4 drops. Okay, so it's infusing properly, and then you start, hey, I administered your medication. Please notify if there's any side effects or adverse reactions. I'll come back to you in adverse reactions. If the flow is going properly, and then it's flowing. When it's done, just to start flowing the right rate or change it. And as well, document on demand, the input and output. The drug is administered properly, no adverse reactions. Client understands. It's all painted, all sterile technique. And then I'll obviously hand you and go out and document. Thank you.